Robbins Pathology chapter number 20 endocrine disorders का हम कंटिन्यू कर रहे हैं and today we are going to talk about thyroid gland की autoimmune disorders. So autoimmune disorders by definition आपको पता है कि what does that basically mean is कि आपकी बॉडी की self proteins identify होंगे by the WBC. So for example this is thyroid gland and it is making a normal protein जो कि अब it's no more normal because it is kind of inviting the WBCs in the body. So WBCs are going to come here and attack these thyroid proteins. So self proteins हैं ये और अब दो तरह की चीज़ हो सकती हैं, या इस प्रोटीन में ऑल्ट्रेशन हो जाए या WBCs की ट्रेनिंग में कोई इशू हो. सो व्हाट्सएवर अगर बॉडी के सेल्फ ऑर्गन के प्रोटीन्स आइडेंटिफाई होके किल होना स्टार्ट हो जाएं अपने ही WBC से, दिस इज द बेसिक आइडिया ऑफ autoimmune disorder. So autoimmunity is the underlying cause of a variety of thyroid diseases which collectively refer to as the autoimmune thyroid diseases, AITDs को हम कहते हैं. So kind of a syndrome है, it's a collection of so many different disorders जिसमें there is collectively general जो common feature है that is autoimmune disorder. Thyroid पे attack होगा WBCs का and thyroid cells will be killed. These disorders include, अभी इनके नाम सुनते जाइए, thyroiditis यानी inflammation of thyroid, antibody mediated disturbances in thyroid function, which means that there will be thyroid or to some component of thyroid antibodies will be generated. So there will be antibody mediated destruction, which is not necessarily associated with inflammation. So inflammation may be there, it may not be there. और ये antibody associated destruction की example है Graves disease. आपने नाम सुना होगा कई दफ़ा इसका. और हम पहले कुछ thyroiditis के बारे में बात करेंगे, फिर Graves disease भी हमारा टॉपिक है. ओके, so thyroiditis encompasses a diverse group of disorders characterized by some form of thyroid inflammation. So obviously नाम इसका है thyroiditis. So itis by definition means inflammation. So thyroiditis means thyroid की inflammation. ठीक है? This discussion focuses on three most common and clinically significant subtypes. और वो subtypes क्या क्या हैं? Hashimoto, thyroiditis. Number 2 is granulomatous, which is also called Quervain, thyroiditis and subacute. So तीन categories हैं जो मुझे डिस्कस करनी है. एक एक करके डिस्कस करते हैं. Hashimoto thyroiditis first of all, पहली thyroiditis की कैटेगरी, और this is also called chronic lymphocytic. और नाम से आपको कुछ आइडिया हो जाएगा कि it is number 1 chronic and there is lymphocytic infiltrate, यानी lymphocytes, T lymphocytes, B lymphocytes, they will be infiltrating within the thyroid gland. Hashimoto thyroiditis is the most common cause of hypothyroidism. Obviously, because of the inflammation, there will be damage to the thyroid tissue and there will be destruction of the thyroid cells. Therefore, there will be hypothyroidism. Okay, and this is very common in the areas of the world where iodine levels are sufficient. So even if the iodine levels are sufficient, if hypothyroidism is prevalent, then you should think about, as a clinician, about Hashimoto thyroiditis. It is characterized by gradual thyroid failure secondary to autoimmune destruction of the thyroid gland. It is most prevalent between this age bracket and is more common in women as in women with a female to male ratio of about 10 to 1 to 20 to 1. So you know, that's pretty common. यानी 10 में से एक फीमेल को ये हो सकता है और यहाँ 20 में से एक मेल को हो सकता है. So that आप नंबर नहीं देखना कि यहाँ विमेन में 10 का नंबर दिख रहा है, फीमेल में 10 का नंबर और मेल में 20 का नंबर. That's the ratio. That basically means कि 10 में से एक फीमेल को हो सकता है, 20 में से एक मेल को हो सकता है. So it's more common in females. Although it is primarily a disease of older women, you see this is the age bracket, it can occur at any age, even in the childhood. Okay, so that's the starting background, and then let's talk about what is the pathogenesis of Hashimoto. Basic pathogenesis आपको मैंने बता दी, it is an autoimmune disorder. So there is autoimmune destruction by the lymphocytes of the thyroid gland. Okay, it is an autoimmune disease caused by an immune response to thyroid autoantigens. So there will be some proteins in the thyroid gland which will be calling off the lymphocytes. Circulating antibodies against thyroid antigens are present in vast majority of patients. The immune response leads to progressive depletion of thyroid epithelial cells. So thyroid epithelial cells are destroyed, and this is why this leads to hypothyroidism. The inciting event lead to the autoimmune response have not been fully elucidated. So ये भी ठीक से नहीं मालूम कि कौन सी एंटीजेंस हैं जो इस immune response को initiate करती हैं. Okay, but what has been observed is there has to be an antigen, और उस antigen के against WBCs यानी lymphocytes infiltrate करेंगे, thyroid cells को damage करेंगे और hypothyroidism की condition generate होगी. Okay. Now, there are so many cells which infiltrate, including CD8 positive cytotoxic T cells. Cytokine mediated cell death then happens T cell activation की वजह से, because once these T cells start killing the thyroid cells, one would start developing hypothyroidism. Binding of anti-thyroid antibodies followed by antibody-dependent cell-mediated cytotoxic, so various mechanisms of killing the thyroid cells. The disease appears to have a significant genetic component as well, based on the concordance rate of about 40% in monozygotic twins. It's a very high concordance rate. एक twin को हुआ तो दूसरे को भी हुआ. That would explain the genetic basis, okay? And the presence of anti-thyroid antibodies in about 50% of the asymptomatic sibling affected with the patient. So one has the disease, the other one, although asymptomatic, 50% of them will have the antibodies, so they have a chance to develop Hashimoto thyroiditis in future. Increased susceptibility to Hashimoto thyroiditis is associated with polymorphisms in immune regulation associated genes, and some of the genes have been actually mapped and linked to this disorder, and this is the one which you have to remember, CTLA4. Okay, right. And this is the gene which actually controls the immune reaction against the self proteins, but if this gene is mutated, then the control of the self antigen reaction is lost and you start developing autoimmune disorders. Okay, so that's the Hashimoto and the iski morphology. Yani, how do you see that on the microscopic slide? The thyroid usually is diffusely and symmetrically enlarged. And again, the reason for enlargement would be that this is the thyroid, for example, and now because of the WBCs, the thyroid gland is destroyed and T3 and T4 levels are down. And once they are down, TSH levels will go up. And if the TSH levels will go up, they will cause enlargement of the gland. Okay, and then the gland is also infiltrated with mononuclear inflammatory infiltrate. Now this include basically lymphocytes, T and B lymphocytes, plasma cells, as well as well-developed germinal centers. उनमें आपको नजर आएंगे. So there is heavy lymphocytic infiltration. इसीलिए इसका नाम ही ये है. If you look at this, it is chronic lymphocytic thyroiditis. So lymphoid cells are infiltrating. Thyroid follicles जो हैं, they are atrophic, ये damage होना शुरू हो गए हैं, and they are lined in many areas by the epithelial cells, distinguished by the presence of abundant eosinophilic granular cytoplasm termed as Hürtl cells. So these are characteristic or oxyphil cells, the characteristic of Hashimoto. This is a metaplastic response of the normal low-cuboidal follicular epithelium to ongoing injury. So these Hürtl cells or oxyphil cells are nothing but the normal cells which were low-cuboidal to low columnar, or continuously जब इनको inflammatory environment मिलता है, so they convert into these cells. Okay, right. This is the metaplastic response. हो गई बात. Now, what is the next important thing? Less commonly, the thyroid is a small and atrophic. This happens, rarely. Usually the thyroid becomes big, which is what we call goiter. Very rarely it also get fibrosis. So this is a fibrosing variant, और fibrosis की वजह से इसका size छोटा हो जाता है. Okay. Clinically, these thyroiditis comes to clinical attention as painless enlargement of the thyroid, and it is usually associated with some form of the symptoms for hypothyroidism as well. जो मैंने hypothyroidism में जितने symptoms आपको कराए थे, that includes lethargy and cold intolerance, and all those things of low metabolic profile will be clinical representation that is of hypothyroidism, right? Right. The enlargement, no. Yep. The enlargement of the gland usually is symmetric, so it is kind of diffuse, right? यानी कहीं nodules नहीं दिख रहे, diffuse enlargement है. But in some cases, it may be sufficiently localized to raise suspicion of a neoplasm. So imagine you have a patient who comes to you with enlarged thyroid. एक आपको local area में enlargement भी मिल रही है, hypothyroidism के symptoms भी हैं, painless भी है ये, तो you will think of neoplasm, won't you? But then the workup shows that this is actually not a neoplasm. In some cases, however, it may be preceded by transient thyrotoxic. To complicate your clinical acumen, sometimes the patient also present with an episode of thyrotoxicosis in the clinical scenario where the patient have this particular phase, because ये जितनी भी थायराइड डिसऑर्डर्स हैं उनमें दिस इज अ कॉमन फिनोमिना कि इवन इफ द पेशेंट इज हाइपोथायरॉइड, सडनली द पेशेंट कैन बिकम हाइपर थायरॉइड बिकॉज एक बर्स्ट हो सकता है थायरॉइड हार्मोन्स का. सो दैट्स समथिंग कॉमन. सो इट्स नॉट एब्सोल्यूट कि हाइपोथायरॉइडिज्म है तो हमेशा हाइपोथायरॉइडिज्म रहेगा, हाइपर है तो हमेशा हाइपर रहेगा, ऐसे नहीं होता. ठीक है. सो दिस मे हैपन. Now, during this phase, when there is thyrotoxicosis, free T3, T4 concentrations are actually elevated and TSH goes away because of the negative feedback, and radioactive iodine uptake is decreased. As hypothyroidism supervenes, यानी जब दोबारा hypothyroidism होगा तो T3, T4 levels जो हैं, they will fall, TSH level will increase, right? Patients with Hashimoto thyroiditis often have other autoimmune diseases as well. और ये general autoimmune disorders जितने भी हैं उन सब का एक general phenomena है कि they usually come in packages. अकेले नहीं होते, काफ़ी सारे होते हैं एक साथ, right? Okay. Often the other autoimmune disorders are there and there is increased risk of developing B-cell non-Hodgkin lymphoma. That is something serious to remember. Hashimoto is associated with this B-cell lymphoma thing. Okay. Hashimoto disease and thyroid epithelial cancer remains controversial with some morphologic and molecular studies suggesting predisposition, but nothing proven कि वो textbook का part बने. Okay. So that's all that you have to remember about very common Hashimoto thyroiditis. Then this is a diagram explaining the pathogenesis of Hashimoto. So what's actually happening is this is the thyroid epithelium. Then there is self-tolerance loss, जिसका मतलब autoimmunity start हो जाएगी, and all these sorts of cells are coming in the thyroid gland, the plasma cells. They will start secreting antibody. The antibody will lead to cell-mediated cytotoxicity of the thyroid cells. There will be CD4 lymphocytes, interferon gamma ka release, epithelium destroyed, thyrocyte injury. CD8 positive cells, these are also lymphocytes. They will also kill and damage the thyroid cells and cytotoxicity. So by different mechanisms, if there is autoimmunity, the thyroid cells are being destroyed, ultimately leading to hypothyroidism condition. Okay. Now the next category of thyroiditis is subacute granulomatous, या जिसका दूसरा fancy name है Decurvan thyroiditis. It is also known as Decurvan, is much less common than Hashimoto, and it is most common between this age bracket, which means a little younger, and like other forms of thyroiditis, more common in women as compared to men. Subacute thyroiditis is believed to be caused by viral infection. So that's the catch point here. If in the clinical scenario they talk about a viral infection and subacute and thyroiditis, think of subacute. Okay, a majority of the patients have a history of an upper respiratory tract infection followed by thyroid symptoms. Unlike in autoimmune thyroid diseases, the immune response in subacute granulomatous thyroiditis is not self-perpetuating, so the progress is spontaneously remits. So that's the good news about it. Okay, then morphology-wise, the gland is firm with an intact capsule, maybe unilaterally or bilaterally enlarged. Easy stuff. Histologically reveals disruption of the thyroid follicle cells, extravasation of the colloid, infiltrating neutrophils, which are replaced over time with lymphocytes, plasma cells, and macrophages. So that's normal inflammation going on. Neutrophil ke baad, more chronic type of cells such as lymphocytes come in, and extravasation of colloid and all these things show basically that the thyroid cells are damaged. Okay, and healing may occur absolutely normal, or sometimes inflammation का जो sequel है, that is fibrosis, can happen. Okay, clinically this form of thyroiditis is very acute. It is characterized by neck pain. So see, in Hashimoto, the enlargement of the thyroid was painless. This is neck pain with swelling. Swallowing का मतलब है जब हम निवाला निगल रहे हैं, खाना खा रहे हैं तो पेन हो रहा है. There may be fever, malaise, and variable enlargement of thyroid gland. It may be unilateral, bilateral, whatever. Transient hyperthyroidism may also occur. See, ये same चीज है जो Hashimoto में की थी. The leukocyte count and ESR rates are also increased, showing inflammation. With the progression of the gland destruction, a transient hypothyroid phase may also ensue. And the condition typically is self-limited, with most patients returning to euthyroid status 6 to 8 weeks. So this is self-limiting. Okay, so this one is a good one to have if somebody has to have, thyroiditis. Now, subacute lymphocytic thyroiditis. So this was subacute granulomatous thyroiditis. Now we have subacute lymphocytic thyroiditis. It is also known as silent or painless thyroiditis. Is a subset of patients, in a subset of patients, the onset follows pregnancy. So everyone has a special feature associated with it. If it is associated with pregnancy, which is postpartum, that you think of this particular variant. If viral, you think of Ch20. The disease is most likely autoimmune in etiology, as circulating antibodies against thyroid are found in majority of the patients, okay? Except for possible mild symmetric enlargement, thyroid appears normal on gross inspection. The histologic feature consists of lymphocytic infiltrate, and seems like it's not a very serious one because it's only one paragraph written over here, as compared to, you imagine, Hashimoto and Ch20, okay? The next other forms, this is very important, radial thyroiditis. It's a rare disorder, but very commonly asked in the exam. So for exam, it's a common disorder. It's a manifestation of IgG4 related disease characterized by extensive fibrosis of the thyroid gland. So that's an important point. If the thyroid gland is extensively fibrosed, think of riddles. Okay, clinical evaluation demonstrate a hard fixed thyroid mass. अक्सर लोग इसको neoplasm समझते हैं. It may be associated with idiopathic fibrosis और ऑटोइम्यून इसकी एटियोलॉजी हो सकती है. मैं आपको बता रहा हूँ, एग्जाम में ये बहुत फेवरेट है, बहुत ज़्यादा पूछा जाता है. ओके, देन कम्स, मैंने आपको इस वीडियो के स्टार्ट में बताया था कि वी आर गोइंग टू टॉक अबाउट ऑटोइम्यून डिसऑर्डर्स, जिसमें एक कैटेगरी है थायरॉइडाइटिस की और दूसरी कैटेगरी है द ग्रेव्स डिजीज. ये देखें, हमने हाशिमोटो डिस्कस किया, हमने Ch20 डिस्कस किया, सब एक्यूट डिस्कस किया. नाउ वी आर गोइंग टू टॉक अबाउट ग्रेव्स, जिसमें इन्फ्लेमेशन होना ज़रूरी नहीं है. अब तक जितनी कैटेगरीज हमने पढ़ी हैं उन सब में वी टॉक्ड अबाउट इन्फ्लेमेटरी सिनेरियोज, बट नाउ द ग्रेव्स डिजीज नॉट नेसेसरली that the patient has inflammatory condition as well, okay? So, Robert Grave, 1835, I mean, way back, oh my god, centuries की कहानी है ये, reported on his observation of a disease characterized by violent and long continued palpitations in females. You know, दिल का धड़कना females में associated with enlargement of the thyroid. So, इनकी observation थी साहब की कि जिनकी neck में ये thyroid mass मौजूद है, उनके दिल की धड़कनें बहुत तेज हैं. So this is the association he observed. Graves' disease is the most common cause of endogenous hyperthyroidism. Important point, guys, hyper. And it is characterized by thyrotoxicosis, which means a lot of thyroid hormones. Infiltrative ophthalmopathy, eyes mein problem in about 40% of the patients, and skin issues, infiltrative dermopathy. And that is seen in minority of the patients, okay? Graves' disease has, that's the triad that you have to remember: thyroid, hyperthyroidism, ophthalmo problem, and dermo problems. Graves' disease has a peak incidence in a very young age, 20 to 40 years of age, with women being affected up to 7 times more commonly than men. So all thyroid disorders seem to be autoimmune disorders. They seem to be more common in females. This is a common disorder estimated to affect 1.5 to 2% of women in the United States. Genetic factors are important in Graves' disease. The incidence is increased in relatives of affected patients, and the concordance rate of monozygotic twins is as high as 60%. So genetic issues हैं, ठीक है? As with other autoimmune disorders, a genetic susceptibility to Graves' disease is associated with HLA haplotypes, particularly DR3, and polymorphisms in genes whose product regulate the T cell responses. Obviously, it's an autoimmune disorder. तो T cell के behavior में कोई भी genetic mutation होगी, it has a potential to lead to autoimmune disorders, okay? Also CTLA4, जैसे Hashimoto में हमने देखा था, and tyrosine phosphate PTPN22. So these are all the genetic mutations which are known to date to be associated with Graves' disease. Then many manifestations of Graves' disease are caused by autoantibodies against TSH receptor. So imagine this. This is the thyroid gland, and here is the receptor which will receive TSH, और ये TSH को जब receive करेगा तो there will be production of T3 and T4. So if there are autoantibodies against the receptor and the receptor becomes hyper-stimulated, that bind to the receptor and stimulate the follicle cells. So there is more and more production of T3 and T4. Okay? So multiple autoantibodies are produced in Graves' disease, such as thyroid stimulating immunoglobulin. ये नाम से जाहिर है, it will stimulate the thyroid gland and it works by adenylyl cyclase, and T3 and T4 levels will go up. इसीलिए इस disease में hyperthyroidism हो रहा है. Okay? Another category of antibody is the thyroid growth stimulating immunoglobulin. Immunoglobulin is the same word for antibody. Either you call it antibody or immunoglobulin is the same meaning. Also directed against the TSH receptor, these antibodies have been implicated in the proliferation of the thyroid follicular epithelium. So इस property से भी ये antibody भी चूँकि growth कर रही हैं thyroid follicular epithelium की, they are also leading to hyperthyroidism. Then there is another category of antibody called TSH binding inhibitor antibody. These anti-TSH antibodies prevent the TSH from binding. So this is exactly opposite to what is being done here. So there is a thyroid stimulating antibody which prevails, and then there is this category as well. And this is why in patient with Graves' disease, you may see episodes of hypothyroidism. Okay, although the prevailing situation is hyperthyroidism, this one, but sometimes patient may present with hypothyroidism. Maybe these antibodies are overactive in those patients at that particular time. A T-cell mediated autoimmune phenomenon is also involved in the development of infiltrative ophthalmopathy. So this is very important. 40% of patient में ये मिलती है. In Graves' ophthalmopathy, the volume of the retroorbital connective tissue and extraocular muscle is increased due to marked infiltration of retroorbital space by the lymphocytes and inflammatory edema and accumulation of extracellular matrix component such as hyaluronic acid, chondroitin sulfate, and increase in the number of adipocytes. इस सारे की वजह से रिट्रोऑर्बिटल यानी आंखों के पीछे जब ये इन्फिल्ट्रेट आएंगे, एडिमा होगा, ये सब चीज़ें फैटी सेल्स बढ़ना शुरू हो जाएंगे, रिजल्ट ये होगा कि आईज को पुश मिलेगा फॉरवर्ड. सो द आई बॉल्स आर डिस्प्लेस फॉरवर्ड, potentially interfering with the function of the extraocular muscle. So eye cannot be closed properly. So Graves' disease के जो typical eye symptoms हैं वो they are classic and they are characteristic of identifying thyroid issue. Autoimmune thyroid disease does span a continuum in which Graves' disease, characterized by hyperfunction of the thyroid, lies at one extreme. So hyperthyroidism में Graves and then Hashimoto and other are hypothyroidism. है ना, तो ये दोनों आपको स्पैन मिल रहे हैं ऑटोइम्यून डिसऑर्डर्स के. नॉट सरप्राइजिंगली देयर इज ऑल्सो एन एलिमेंट ऑफ हिस्टोलॉजिक ओवरलैप बिटवीन द ऑटोइम्यून थायराइड डिसऑर्डर. सो मेनी ऑफ देम समटाइम्स प्रेजेंट विद hyperthyroidism and they may shift to hypothyroidism. So that is something that you have to remember. Also, if there are thyroid problems present, you should also be thinking about other problems, because usually autoimmune diseases are also coming up with diabetes, pernicious anemia, SLE, Addison disease. So other autoimmune disorders are also present. Okay. Now, Graves' disease की थोड़ी सी morphology. The thyroid gland is enlarged, usually symmetrically due to diffuse hypertrophy. So diffuse enlargement है. The gland is usually smooth and soft. On microscopic examination, follicular cells in untreated cases are tall, columnar, more crowded, hyperactive, and they have very active papilla. Such papilla lack the fibrovascular cores in contrast with those of the papillary carcinoma. So this is the distinction from the cancer. Okay. Changes in the extrathyroidal tissue also include generalized lymphoid hyperplasia all over the body. In individuals with ophthalmopathy, the tissues of the orbit are edematous and they are also infiltrated with immune cells. And they also have deposition of extracellular matrix such as glycosaminoglycans, heparin sulfate, chondroitins, and all these sort of things. Okay. So talking about the clinical features of Graves' disease, now you have an idea. The patient is going to present with thyrotoxicosis, hyperthyroidism. So all the situation of hypermetabolic state will be manifested in these patients. So heat intolerance, being overactive, नींद नहीं आ रही, restless, sleepless, palpitations, all these sort of things, goiter, they will be present in patients with Graves' disease. They also have diffuse hyperplasia of the thyroid. We know that they have eye issues and they have skin issues. The degree of thyrotoxicosis varies from case to case. Obviously, कितना hyperplasia हुआ है, ये सब में अलग-अलग है, right? The ophthalmopathy of the Graves' disease result in abnormal protrusion of the eyeball. आंखें ऐसी फटी-फटी बाहर निकली होती हैं, which is what we call exophthalmos. The exophthalmos में persist, और ये किसी डायग्राम में I don't know, I think मैंने पिछली किसी वीडियो में जब there you go. So that is typical hyperthyroidism. Okay, so this is how the patient looks like. Protruding eyes, okay, which is called exophthalmos. The exophthalmos may persist or progress despite successful treatment of thyrotoxicosis, because sometimes this damage, which is done to the retroorbital tissue, persists for a very, very long time. The extraocular muscles often are very weak because of the infiltration of edematous tissue and fat and immune cells. They become very weak. वैसे ही बेचारे इतने छोटे से तो होते हैं. The infiltrative dermopathy most commonly involves the skin overlying the shin areas, where it manifests as a scaly thickening and induration of the skin, which also has a specific name called pretibial myxedema. So exophthalmos आपको याद होना चाहिए, pretibial myxedema आपको पता होना चाहिए. The skin lesions may be slightly pigmented, papules or nodules, and often have an orange peel texture, जैसे orange का peel होता है, right? नुक्ते type की चीज. Laboratory findings in the Graves' disease will be high T3, T4 and low TSH. Because of the ongoing stimulation of the thyroid follicle by the TSIs, these are the antibodies, radioactive iodine uptake is increased because the follicles are working more. So देखें जब आप कोई रिव्यू बुक पढ़ते हैं ना, तो ये सिर्फ चीज़ें बुलेट पॉइंट्स में लिखी होती हैं कि increased uptake of radioactive iodine. अब उसकी डिटेल तब समझ में आएगी जब आपने रॉबिन्स पढ़ रखी होगी, है ना? So that's all about autoimmune disorders of thyroid. Next video will cover the next topic. तब तक के लिए अपना ख्याल रखिएगा भाई. Take care of yourself.